Hello everyone, my name is Vignesharan Alakisasikumar and I am from Diploma Medical Lab Technology from UNICEF. Today, I am going to discuss about topic blood cell count. First of all, let me explain what is blood cell count. A blood cell count is a measurement of the number of red blood cells, white blood cells and also platelets in our blood. The blood cell count also counts the amount of hemoglobin and the hematocyte, which is the amount of whole blood that is made up of red blood cells. So, what are the functions of blood cell count? The blood cell counts help us to assess general health, diagnose medical condition and monitor existing condition of the patient, and also evaluate the effectiveness of treatment then given by the doctor to the patient. For example, abnormal blood cell counts can indicate the underlying health issue, such as low blood cells count can indicate anemia present in the patient. So, what are the methods to count the blood cells in our body? Firstly, we can use hemacytometer to count our blood cells. It's a specialized counting chamber that used to determine the concentration of cells in a liquid sample. There are several types of hemacytometer, all with different counting grades, but the most commonly used is the improved Newbar chamber. Before I further explain about the improved Newbar chamber counting, I would like to give some information regarding RBC and WBC pipette marking and what's their role in hemacytometer and what's the diluting solution that usually we use for hemacytometer. Firstly, for RBC, our marking will be until 101, while for WBC we should mark until 11. Why there's different marking for RBC and WBC in pipette? First of all, red blood cells are vastly more numerous than WBC in our blood. This means we need to dilute them differently to count them accurately. Dilution is for easier counting. Dilution will spread out the cells and preventing them from clumping and making them easier to view under a microscope. So for RBC dilution, RBC needs a much higher dilution compared to WBC because there are so many of them, and pipette marking for RBC helps achieve 1/200 dilution. For example, we should draw the blood up to 0.5 and diluting it with the RBC diluting solution until 101. This is equivalent of adding 199 parts of diluting fluid to 1 part of blood. However, for WBC dilution, we need lower dilution as there are fewer of them. Pipette marking for WBC helps achieve 1/20 dilution as we draw the blood up to 0.5 and diluting with the solution until 11. This is equivalent of adding 19 parts of diluting fluids to 1 part of blood. The marking on the pipette acts as a measuring guides for drawing up the correct amount of blood and diluting fluids. These simplify the process of achieving the precise dilution needed for accurate cells count. The different dilution ensure the hemacytometer chamber contains a manageable number of cells for accurate counting. Let's see what are diluting solutions that are used for RBC and WBC. For RBC, we usually use normal saline or heme solution. Heme solution is preferred because it can ensuring the isotonicity of the red blood cells and also preventing them from hemolysis. While for WBC, Turk's fluid is usually used because it can use to lyse the red blood cells while preserving and staining the WBC. This can make us easier for counting WBC under a microscope. Now, you all have some general idea regarding WBC and RBC pipette marking and what's their role in hemacytometer. So, now let's see the RBC counting. For RBC counting, we use the center square of the improved Newbar chamber, and this center square is the largest square in the grid. It's further subdivided into 25 smaller squares as you all can see in image, and these 25 smaller squares will then subdivide it into 16 even more smaller squares. This is because due to the high concentration of RBC, counting them in this smaller area allows for a manageable number of cells to count. In this grid, we also counted the platelets. So what are the formula to count the RBC? For RBC, the formula that we usually use is number of cells counted multiplied by dilution factor with the depth and following with area of counted. Move on to the corner square. There are 4 largest corner squares located at the 4 corners of the grid. Each of these corner squares is subdivided into 16 smaller squares. These are the squares that we are primarily used for counting WBC. WBC are typically present in lower concentration than RBC, so counting them in this larger corner square provides a sufficient number of cells for accurate counting. The larger area of the corner square allows for efficient counting of the relatively fewer WBC in our blood sample. The formula to count the WBC count is number of cells counted multiplied with dilution factor followed with depth factor and divided by area of count. Let's move on last part of the hemocytometer, which is platelet counting. As I said before, we use the same central square of the improved Newbar chamber grid to count for platelets as RBC. So, as you all can see in the image, we only count the 5 squares that label as P in the central square, and we don't count the platelets along the green line, which is left and upper line in the grid. So, the whole formula for platelet counting we can summarize into average number of platelets that we counted multiply into 100 and along with 1 mm square we divided with the depth factor, which is 0.1 mm, and then we multiply with 10 power of 6 will be equal to total platelet counts multiplied with 10 power of factor 9 per liter in our blood. Other than hemocytometer, another method for blood cells count is the peripheral blood smear. Peripheral blood smear is a microscopic examination of a thin layer of blood which we smear on a slide and then stain with Leishman stain. This slide we further analyze to assess the morphology like shape, size and appearance of the cell and number of blood cells, including red blood cells, white blood cells and also platelets. The proper smearing and staining technique is very crucial in peripheral blood smear as the whole result is dependent on that. We usually observe the cells in the part of body as you all can see in the image in the slides. Peripheral blood smear, we can identify 5 types of leukocyte present in our blood, which is neutrophil 50 to 70%, eosinophil 1 to 5%, basophil 0 to 1%, which is very rare in our blood, monocyte 2 to 10%, and also lymphocyte 20 to 45% based on their staining property and also size. However, for RBC, we usually observe for their color and also size. For size, if there is abnormality, we report as macrocytic, which is larger than usual, or microcytic, which is smaller than usual. However, for color, we report as hyperchromic, which is highly colored, or hypochromic, which is less colored if there is abnormality. Lastly, other than hemocytometer and peripheral blood smear, we can also use the automated blood counter to count for blood cells. Automated blood cell counter, also known as hematology analyzer, hemogram or CBC test, are the instruments that rapidly and accurately quantify blood cell parameter like RBC, WBC and platelets. This automated blood counter offering a more efficient and less subjective alternative to manual methods like hemocytometer and also peripheral blood smear, and this is very less time consuming method for blood cell count. Usually automated blood counter will be used in hospital as in the hospital we get a lot of sample at the same time and we need a rapid result to help for patient treatment. All we need to do is just to insert our blood sample into this automated blood counter, and then the result we came out with is is there any abnormalities in our blood, as this automated blood counter follows schemes that given in hospital. Conclusion: blood cells counts are very crucial in our daily life as it can help us to detect the hidden illness and spot the problems early, like from the infections to anemia. Blood counts can reveal the issue before they become serious and also guide treatments. They allow the doctors to see how well treatments are working and make the necessary adjustment, and also it always keeps us healthy. This is because by monitoring our blood counts, we can stay top of our health and make informed decisions. In essence, blood counts are simple yet powerful tools that plays a crucial role in keeping us healthy and informed. I hope this video clears some doubts in your mind and really useful for educational purpose. Thank you for listening throughout the video patiently, and thank you for paying attention.